Good morning, everybody. Thank you very much, Mr. Chairman. Thank you, Dr. Walid, for this invitation. Thank you all for coming early this morning for the session. The topic I'm going to tackle today is an interesting topic, and hopefully it will reflect the burden of the disease and the magnitude of the problem of congenital heart disease. I'm going to talk about the prevalence of heart failure and congenital heart disease. Honestly, we don't have a clear prevalence in our region, but I'm going to show you some data which can reflect the magnitude and the burden of congenital heart disease. Can do it. Okay, thank you very much. It's working now? Yeah. Okay. So first of all, I'm going to talk about the types of congenital heart disease we have and the prevalence worldwide, then the prevalence in adults and pediatrics. Before I talk about the prevalence of heart failure in congenital heart disease, I will show some data of our national experience in Riyadh King Faisal Hospital, and then I will leave the rest of the slides for the management to the rest of the group. So first of all, in general, adult congenital heart disease accounts for 1/3 of the major congenital abnormalities as an introduction to congenital heart disease. The age parameters of patients with congenital heart disease in the region or Saudi Arabia is 14 and above, in comparison to the 18 and above in North American studies. Now, the American College, the ACC, published their guidelines. We have also the European and the Canadian guidelines. All have 3 important recommendations because we are dealing with a unique group of patients. The first recommendation is to organize the care and to improve access of care and address special needs of patients with congenital heart disease. One of these special needs is management of heart failure or advanced cases. So in general, we can divide patients into simple or complex according to the structure of the disease, low risk or high risk, especially if they are prone to have heart failure, and unrepaired or repaired or palliated. The guidelines which we use more commonly is the American guidelines, which show that you can divide patients into 3 groups: simple, moderate, and great complexity. This is the list of patients with great complexity, where you have patients with cyanotic congenital heart disease, Eisenmenger, Fontanes, and other repair, complex repair are considered as a great complexity. This is an example of simple and complex. Simple like an ASD, complex like TGA before repair and after repair. For example, for DTGA, you have an atrial switch and you have a systemic ventricle facing the systemic circulation. Again, the same thing for the CCTGA, which is a congenitally corrected transposition, where you have a systemic ventricle connected to the systemic circulation. Again, another unique group of congenitals are patients with tricuspid atresia or single ventricular physiology who are repaired with tunnel. We call it a Fontan tunnel. So you have either an internal tunnel or external tunnel. We call it a Fontan. The other unique group are patients with Eisenmenger, where they have fixed pulmonary arterial hypertension in the setting of cyanosis and elevated pulmonary vascular resistance. So why we're interested in these groups before we go to the prevalence? Those groups are palliated when they are young with many shunts, and they might develop heart failure. So heart failure is one of the morbidities of patients with congenital heart disease, in addition to the other morbidities like arrhythmia, residual shunt, pulmonary hypertension, or residual lesions, either valvular or vascular. Most of the presentations in general of patients with congenital heart disease are either presentation of heart failure symptoms or arrhythmia symptoms. This is why heart failure is considered one of the major comorbidities and one of, I would say, one of the KPI indicators of assessment of patients with heart failure in this subset of groups with congenital heart disease. Now let's start with the congenital heart disease and the prevalence of congenital heart disease in pediatrics or in birth. Birth prevalence in this study, which is a worldwide study, showed that the prevalence is almost 9 per 1,000 in Asia. And it's different from Europe and North America because of geographical differences. Now, why it's difficult to get the exact prevalence? Actually, the European guidelines pointed that it would be difficult to get the exact prevalence of adult congenital heart disease, given that you have a different heterogeneous group. Sometimes the presentation might happen in adult, and the other thing, they might have more than one lesion. You can add to that the different age group. We classify adults as more than 14, they classify adults as more than 18s. Now let's look at the prevalence in adults. So this is a North American study in Quebec City. They looked at the prevalence in adults. So this is the number they quote, which is 4 per 1,000 adults. And they extrapolate this number to different countries in the world, and if you translate that into Saudi Arabia, you might have large number of patients with congenital heart disease with adults and congenital heart disease. So let's talk about Saudi Arabia. This is the only study I have found in the literature where you have looking at the geographical distribution of patients with congenital heart disease, and this is in the pediatric age group. So most of them are concentrated in the southwest area of Saudi Arabia and some in the eastern area. Regarding the prevalence of pediatrics with congenital heart disease, this is the only study I have in Saudi Arabia, and it's mentioned around 8 to 10 per 1,000. So in summary, we have prevalence of pediatrics worldwide, North American, and in Saudi Arabia, but we don't have any prevalence of adults with congenital heart disease. And this makes my presentation a little bit challenging to tell you the exact prevalence of heart failure and congenital heart disease, but let's tackle it this way. This is how complex is the hemodynamics and the etiology of heart failures in patients with congenital heart disease. So you have to look at 3 parameters. You have to look at parameters affecting preload, afterload, contractilities. For example, if we take tetralogies might have problem with contractility in the right ventricle, they might have fibrosis, they might have preload problems of severe pulmonary regurgitation. All these factors can contribute to heart failure. You have to add to that another pathogenic factors, most likely pressure and volume overloads or residual lesions. And don't forget arrhythmia. Arrhythmia can predict and can cause heart failure as an arrhythmia-induced tachycardia or heart failure-induced tachycardia. Now, going back to some of the lesions like Fontane's, we have some reported numbers like 7 to 10% incidence of heart failure in patients with Fontane. Fontane is a unique group. I'm not going to talk about it now, and I will leave it to my colleagues. So, to diagnose heart failure and congenital heart disease like we used in the acquired heart disease, you should have 3 parameters. You should have abnormal structure and function. You should have poor functional capacity, which we can diagnose by VO2 max, and you can assess that by having a blood test, like looking at the neurohormonal activation, especially the PNP. So looking at the literature, 21% of patients might die from heart failure. This is the numbers we quote in the literature. If we look at a specific group with a single ventricle, like TGA or LTGA mastered or CCTGA with a systemic right ventricle, 32% develop heart failure at different stages. Now, this is an interesting topic quoted the incidence of heart failure in patients with congenital heart disease. It's around 26%. And actually, they look at, again, a unique group of patients with simple, with moderate, and complex congenital heart disease. And they found that the higher probability of incidence of heart failure happen in patients with single ventricle, in patients with TGA, repaired, mastered, or sinning, or CCTGA without repair, and in one of the groups of tetralogies where they have residual severe pulmonary regurgitation. So this is the high risk group where we can find a higher probability of heart failure. Now, so all this is the international data. What about our local data? Unfortunately, I have only a study I published in King Faisal Specialty Hospital, King Faisal Heart Institute, when I was a consultant there. And what we did as a group with Dr. Zuhair Al-Halis, we looked at a group of patients retrospectively. The total number was around 500 patients, and patients who are 14 years of age and above. And we classify patients into 5 groups, and we look at the pattern of admissions. I'm talking here about admissions, okay? So we classify patients into 5 groups. One of the groups is patient with a complex congenital heart disease, where we put patients with any congenital heart disease and ventricular dysfunction, or patients with Epstein's, single ventricular pathology and physiology, or Eisenmenger's and TGA. And we look at their demographics, admissions, causes of admissions. And this is what we found. The median age is around 21%. This is the subgroups. Most of the groups admitted are patients with complex congenital heart disease. 23% they come to the emergency room, and the majority have cardiac symptoms. So the majority of patients who are admitted are patients with complex heart disease, and the major cause of their admissions is cardiac symptoms. The most common symptoms are heart failure or arrhythmia. Heart failure more than arrhythmia. So again, this is a graph which showed that patients with complex congenital heart disease are the most commonly seen in the emergency room, rather than looking at the elective group. This is the elective admissions, and this is the emergency admissions. So in the literature, we have this data which showed the prevalence. So we're talking about a different topic now. We're talking about the prevalence of patients with congenital heart disease and heart failure. Okay, so I talked about admissions, most likely cardiac symptoms, and the most common is heart failure symptoms. Now, this actually study showed the comparison between age and the probability of heart failure, looking at incidence of heart failure. And I was looking in the literature if we have any data which can be consistent or not with our findings. And this data showed that with increasing age, you have increasing probability of heart failure in patients with congenital heart disease. But who are these groups? This is the groups. First one is the single ventricle, like Fontane's, as we found in our study. Second group are tetralogies with residual severe pulmonary regurgitations. And the third group are TGA, or with mastered, who have a systemic ventricle facing systemic circulations. Actually, they have a nice comment that coarctations are the least to develop heart failure. So the conclusion from the study we did in Riyadh, that admissions are increasing. Admissions happened more in patients with complex congenital heart disease. And I think the point we can take from this lecture is that if you have a program of congenital heart disease, you should look carefully for the high-risk group, like patients with heart failure and arrhythmia, and you have to tackle it very quick. You have to look for the predisposing factors like we do in acquired heart disease. And we can extrapolate some of the data and the medications used for management of patients with acquired heart disease into congenital heart disease, but carefully. So in general, the prevalence of heart failure is variable, depending on the age. The higher the age, the more complex the disease, the higher the probability of having heart failure. And it depends on the associated lesions like severe pulmonary regurg in tetralogies or severe tricuspid regurg and CCTGA. And I think the best way we can get and estimate the prevalence is to have our national data of adult congenital heart disease in the Gulf area, Saudi Arabia and the Gulf area, and we look at the high-risk groups like patients with heart failure. Thank you very much.